Hello everyone, welcome back to Scalia.com. My name is Mahmoud Osama and today we are talking about the vascular system and its pathologies. And this part of the lecture is going to be about functional vascular disorders and hypertension. So we are going to talk about the functional vascular disorders, essential hypertension, secondary hypertension, and as well as malignant hypertension. So let's start off with functional vascular disorders. We have the Raynaud disease and the Raynaud phenomena. So in Raynaud disease, it is actually a manifestation of a recurrent vasospasm in which smooth muscles in the tunica media actually contract, resulting in occlusion of the blood vessels and then removal of that occlusion, and thus rehabilitation or of that blood flow, so that blood flow starts flowing again. And this occurs usually in small arteries and arterioles in Raynaud's disease, and when this happens, it results in pallor or cyanosis, most often in fingers and toes, as you can see in this picture. So due to the vasospasm, the blood stops flowing, and this results in this discoloration, and as soon as it is restored, the blood flow is restored, the color starts to fade away, and it is most commonly in young healthy women. So Raynaud phenomena is similar to Raynaud disease but is always secondary to underlying disorder, and most characteristically systemic lupus erythematosus, which is also known as SLE, or progressive systemic sclerosis. And in that as well, the blood supply is impaired due to the vasospasm, which results in discoloration, first of all whitish discoloration and then bluish discoloration of the tips of the fingers or the toes, and then it becomes red as soon as the blood flow starts to return or the occlusion is removed and the blood flow is restored. The second topic is hypertension, and it is perhaps the most important topic in my opinion because it is the most common condition that we see in our patients associated with the vascular system. So hypertension is actually also known as high blood pressure, and which is greater than the normal blood pressure, which is 120 by 80 millimeter of mercury. So it can be either essential hypertension, secondary hypertension, and malignant hypertension. So we need to see what these terms actually are. So essential hypertension is actually not because of any known cause. So it has an unknown etiology, and it is the type of hypertension which is present in majority of the cases. And however, there's an interaction with the predisposing determinants and risk factors, and also with the number of exogenous factors as well. So what are the determinants or risk factors of essential hypertension? They include the genetic factors as well as environmental factors. So genetic factors include the family history, more common and severe in African lineage, but this genetic factors is actually non-modifiable risk factors, but environmental risk factors can actually be modified. So they are modifiable risk factors, which includes dietary sodium intake. However, in some individuals, it is observed that they have a very high dietary sodium intake, but is not associated with hypertension. But in others, it is associated with hypertension as well. On the other hand, there is stress, because stress results in neurogenic vasoconstriction, which results in high blood pressure and hypertension. Other modifiable risk factors include obesity, cigarette smoking, and physical inactivity. Now, what are the results of essential hypertension? If untreated, it can eventually lead to retinal changes, left ventricular hypertrophy, and eventually cardiac failure. It can also predispose to ischemic heart disease and stroke or cerebrovascular accidents, which are both very important, as they are the leading, you can say, cause of mortality. Now, the secondary hypertension is another type of hypertension which can be either because of any other disease or underlying condition or disease. So one of them is because of the renal disease, because renal disease has a very close functioning with the blood pressure and regulating the blood pressure because of its renin-angiotensin system. So it is the most common type of secondary hypertension, and the causes of renal hypertension are either because of the disorders of the renal parenchyma or because of unilateral renal artery stenosis, which results in impaired blood flow to the kidney. So in case of the impaired blood flow to the kidney, the blood pressure to the kidney falls, or either the blood pressure to the kidney falls or the overall blood pressure falls by any reason. That results in activation or production of the renin, which activates the angiotensinogen 2 or the angiotensin to angiotensin 1, and then that is converted by the angiotensin converting enzyme to angiotensin 2. This angiotensin 2 then activates the aldosterone in the adrenal cortex, and it also results in increase in blood pressure because it acts as a vasoconstrictor as well. So once it stimulates the angiotensin 2, the renin angiotensin system, so by vasoconstriction the blood pressure increases, and secondly by the activation of the aldosterone there is actually retention of the sodium and water, which also results in increase in blood pressure or hypertension. Now, other causes of secondary hypertension include primary aldosteronism or Conn syndrome, which is associated with adrenocortical adenoma or bilateral adrenal hyperplasia, because adrenocortical adenoma or bilateral adrenal hyperplasia will result in a greater production of aldosterone, which will result in greater retention of sodium and water and decreased serum potassium, resulting in hypertension. The second is acromegaly or Cushing syndrome, in which pituitary or adrenocortical gland is actually stimulated, or there's pheochromocytoma or hyperthyroidism, in which obviously once again the aldosterone secretion is increased, and that results in hypertension once again. And at the last but not the least, diabetes mellitus is also associated with hypertension. Other causes of secondary hypertension include coarctation of the aorta, in which the hypertension is limited to the upper extremity only and not the lower extremity. That is because, as you can see here, there's actually coarctation here. So the blood comes out of the aorta with a very high pressure in the upper body, and that results in higher blood pressure in the upper body, but lower blood pressure in the lower body. It can also be because of pregnancy, toxemia of pregnancies, and the CNS disorders, especially brain tumors, and also drugs and chemicals such as amphetamines and steroids, which actually result in increase in blood pressure. Now, very important condition, which is the malignant hypertension. It is actually the complication of either the essential hypertension or the secondary hypertension, and it is characterized by a marked increase in diastolic blood pressure, as well as focal retinal hemorrhages and papilledema, and left ventricular hypertrophy and failure. So here you can see focal retinal hemorrhages, and it is also a cause of early death from congestive heart failure, cerebrovascular accidents such as stroke, and renal failure as well. And it occurs in less than 5% of patients with elevated blood pressure, most often in young African males, and it results in malignant changes of renal nephrosclerosis and glomerular capillaries rupture, resulting in flea-bitten kidney. As you can see in this picture, these red spots, as some flea has bitten on the skin. So this is similar to that. And then there is multiple pinpoint petechial hemorrhages, as you can see in this picture as well. Large swollen kidneys, you can see the swelling of this kidney, and necrotizing arteriolitis and glomerulitis with pulmonary necrosis. So the kidney function is also impaired in malignant hypertension, and there's also hyperplastic arteriosclerosis as well. So that was all about the functional vascular disorders and hypertension. I hope you learned a lot, and keep on visiting scardia.com for more lectures like this. Thank you very much.